Now for the winner of the Cataract Complications and Challenging Cases category. And the winner is Microinvasive Surgery to Solve a Rare Ophthalmic Disease. Producer Carl Braze from the Netherlands.
Outstanding video. The beautiful illustrations, animations, artistry was something that we have to share with you. So please let's watch this video.
Dear Dr. Brasser, for a couple of months I have been suffering from a dense cobweb in my left eye that is impairing.
Well, congratulations, Carl. As I said, a beautiful video, quite masterful. Carl, would you like to say a few words about the video? Or?
Colleagues, dear judges, dear Graham, it's a pleasure being here. It's an honor to receive this award. Actually, I turned in 2 videos. I was surprised that this one won. I was even thinking, will I send this movie in? It's not a mainstream movie. It's not a mainstream problem. It's a cataract and refractive surgery conference here, but then I thought, well, amyloidosis exists. You don't see it very often. You might see it once in a lifetime. You might see it never, but a girl in that age doesn't deserve a pars plana vitrectomy, so we should know it. Marie Tassignon said to me, show it, colleagues have to see it, that they know that they know what the disease is. You don't need histology. It's pathognomic. Well, that was the diagnosis. Treating it was kind of tricky. Some of you might know I'm involved in YAG laser vitreolysis, and you might be skeptical about YAG laser vitreolysis. It's a wonderful procedure if you do it right, and if you do all precautions and in technical perfection. You can't treat every vitreous floater, but knowing how to do this, she actually came to my vitreolysis practice. I was thinking about trying it. It's basically a capsulotomy, a YAG laser capsulotomy in the depth of your eye. The posterior vitreous membrane is not as fragile like the posterior capsule. It's more rubber-like, and it took me several sessions, but it worked eventually. Patient is happy. I've seen her once again in January before I released this movie to be on the safe side, and she's still happy. She sees an ophthalmologist twice a year. I don't know what's going to happen with her in the future. She might develop high ocular pressure. As you've seen, the amyloid in the vitreous that has, I'm sure, some complications in the future, but for right now, she's happy. She's going to be married, and I was very happy to see her again in January, and I will tell her right away that her movie won here. Yeah, she will be pleased about that. So thank you so much.
Thank you, Carl. Judges, do you have any questions or comments for Carl?
I have a quick question.
Yes.
Is there any particular pattern that you would apply this vitreous YAG laser treatment?
Yeah, I mean, you're talking about cruciate pattern and about cross pattern. I'm not a believer in that. Who is interested can watch my movie, which I turned in as well. I do it totally different. And in the depth of the vitreous, that doesn't work at all. You're a freelancer in the depths of the eye. Hopefully I never have to do that again.
Quick question. So she married because you treated her?
I'm happy. Okay. I'm happily married.
Right. It's a really wonderful video. Yeah.
Thank you very much. It's wonderful being here. Yeah. Correct.
Congratulations, Carl.